Well, first, I want to say thank you all for joining in. It's going to be a great evening. We're going to wrap up because I know folks want to check out the debates and things that are happening as you go out and make change in the world. But before we get there, I want to say I'm super excited because this weekend is World Polio Day, October 24th. And for those clubs and Rotarians in our district, and especially San Antonio, October 24th is now recognized and declared as World Polio Day in San Antonio. So again, Mayor Ron Nirenberg announced that on October 8th, and we're very happy for that particular announcement. So this evening, we have a great group of panelists on the call, on this call this evening. First off, we have our very own Mike McGovern from Rotary International. He is our Polio Plus committee chair, and he's been in that position since October 2014. And in this role, he is the volunteer leader of Rotary's largest humanitarian project, the global eradication of polio, hence why we're all here this evening. Rotary is the spearheading partner of the Global Polio Eradication Initiative and has donated over $2 billion to ending polio, and has worked with other partners to reduce the number of polio endemic countries from 125 in 1988 to 2 countries today. Mike also represents Rotary on the Polio Oversight Board. So thank you so much, Mike, for being here this evening. Next up on our list of panelists, we have Past District Governor Carl Chinnery. Now, Carl Chinnery was the Vice President of Kansas City Life Insurance Company until 1976, when he established his private law practice, now known as the Chinnery, Evans, and Nell in Lee's Summit, Missouri. Carl has done legal work for over 130 nonprofits, including churches, athletic organizations, humanitarian groups, and civic and service clubs. He has received the Service Above Self Award, the Citation for Meritorious Service, the International Award for a Polio-Free World, and the Distinguished Service Award. Here's a key little information about Carl. He's a polio survivor, and he and his 4 older brothers and father contracted polio within a 3-day period. So he has a lot to share this evening in regards to polio. And we have our very own Dr. Linda Ellsworth. She is our medical director in our district, 5840. This is a new position. We never had it before, but when COVID-19 struck, we wanted to create a position for someone that has oversight on where we needed to go and how we needed to direct the clubs. And so we just appreciate Dr. Linda for being on this call. She's a native Texan and a graduate of Rice University. Dr. Linda Ellsworth obtained a PhD in physiology as well as her MD. In her specialty of obstetrics, see, I'm from Georgia, so you should have broke that down. Okay. And now Jerry's from Georgia too, so I should have had him say this word. But also gynecology. Dr. Ellsworth produced the first test tube baby in San Antonio, and she recently has studied the role of lifestyle and health. She is proud to be in Rotary District 5840 as the director and supports Rotary's important role in the worldwide effort to eradicate polio. And with 1 minute left, last but not least, we have our very own Paints for Polio chair, that is Charlie Wasser. He will be on this evening as well, discussing the role of Polio Plus within District 5840 and the initiatives that we're working on to raise money and also contribute to such an important eradication. So without further ado, I am going to introduce, well, we've already introduced the panel. Without further ado, Mike, if you could just share, I guess, discuss the status of what RI is doing and the status of Polio Plus from your perspective.
Thank you very much, Governor, and it's great to be with you all in Texas today. Tonight I was getting hungry looking at all those fundraising events coming up. I remember reading about New Braunfels at one point, a German background town, if I remember right, and I think I read they had an Oktoberfest or something there. But anyway, good to be with you. Good to be with you tonight. You know, polio. You know, when I think of polio, and now I think of our COVID pandemic, you know, in many respects, you know, so many things are so similar. You know, back in the 20th century, you know, most people in America really feared polio. You know, there was major fundraising that went on through the March of Dimes. You know, a lot of it came about because of Franklin Roosevelt, who it's believed had polio. He actually caught that or got it when he was visiting in Maine during the summer, not too far from where I live. But it's but even then, there were signs up saying, children under the age of 16 are not allowed in this community unless they live here. And, so as a result, there was this fear. People didn't go to movie theaters. They didn't go to swimming pools. They didn't go to all these other things. And, eventually, people gave money. The government spent some money. And Jonas Salk, whose birthday, by the way, is the same as World Polio Day, no coincidence there, developed the polio vaccine. That was the injectable type. Albert Sabin came along, and he did the oral polio vaccine. The one that is mostly used today in most of the world, where Rotary contributes to, is the oral polio vaccine. But if your children, grandchildren, when they get their polio immunizations here in the United States, they're all getting the injectable type. The injectable is an inactivated virus. The oral polio vaccine is what they call an attenuated live virus. So, at this point in time, when we started this, we're 350,000 cases a year. Now we have 200 cases. For the last 5 years, we've had less than 200 cases. This year, Joan Perkins is on the call. She keeps track of the numbers every week. I think it's 133 cases effective today. They're all in Pakistan. They're all in Afghanistan. We do have something called vaccine-derived cases as well. Maybe we'll talk about that a little bit later. But the biggest news with polio recently is at the end of August, the African region of the World Polio, of the World Health Organization, was declared free of the wild polio virus. And when you think there's 47 countries there, that's just an amazing achievement. It was first kicked off, a campaign to accomplish that about 20 years ago by Luis G.I., a past president of Rotary, was involved. And the other major person was Nelson Mandela. So, there's a very historic connection there. So, you mentioned, in the introduction, some of the amounts that have been spent. But, I want to look at, what we've really accomplished and, what's the impact from us, all of us as Rotarians. There's 19 million people now walking on Earth who otherwise would be paralyzed if Rotary hadn't started this. So just when you think of that, 19 million people who would otherwise be paralyzed. Since 1988, we've immunized 3 billion, with a B, children. That's a big Texas number. 3 billion children. Last year alone, we immunized 430 million children in 40 countries, and we gave them over 1.2 billion doses, because you have to give everyone several doses. We've gone 4 years since the last case in Africa. It was in Nigeria. Before that, the last case outside of Afghanistan and Pakistan was in Somalia, and that was 6 years ago. We've also helped with, we call it Polio Plus. We've also helped with other vaccines from time to time, including measles and rubella. We give vitamin A supplements. We also do things like wells, and during this COVID experience, we've been giving a lot of hand soap, hand sanitizer, masks. We're doing these other activities. So as we had to suspend polio vaccinations house to house for a while, but we've started them up again. But we're doing it in a way that is appropriate in every way for all the training that we have with to our polio workers and otherwise. We're also been using our labs to help out with contact tracing, with analysis, with testing in many areas we work. But we do expect to be reimbursed for that cost, or the partnership does, by a fund that the World Health Organization has. Rotary, as mentioned, continuing to raise a lot of money, which is great. Clubs, clubs and individuals have been very, very generous, and that is just so appreciated. And it's still, every dollar is still being matched by the Bill and Melinda Gates Foundation, 2 to 1. They've agreed to do that for the next 2 years. So I remain confident that we're going to eradicate polio. We have a good sized staff that does it, but mainly we rely on what we call community-based vaccinators. They are the individuals, they live in the communities where the vaccinations are going on. They're paid small stipends. That's where we spend a lot of our money, that and buying vaccines and trying to encourage people to take the polio vaccine. But it's those individuals that are the key core part of the program. Rotary still, as well as its own money, we advocate to governments. The US government is the second most generous supporter of polio eradication after the Bill and Melinda Gates Foundation. Rotary's third on the list, and fourth, by the way, is the government of the United Kingdom, or as I would call it, Her Majesty's government. And there's a number of other countries as well, but it's Rotarians in those countries who go visit those leaders. We also advocate in countries where there is polio. For example, I just accepted an invitation to attend a meeting in the Democratic Republic of the Congo on December 9th. I'm doing it virtually, but it's to meet with the president of that country in order to ensure that we sustain the wild polio virus and that we also take care of these vaccine-derived cases. So people ask, and the final comment I wish to make is, what's the number one obstacle? Why isn't this done? It's all about convincing the mothers and fathers to get the 2 polio drops in the mouths. We've been able to do that in most places. Obviously, polio's gone from 200 countries. It's only really left in 2. But in Pakistan and Afghanistan, we've had a tough time. There's been some issues with social media, with false stories. There was the story some of you may have heard of before Osama bin Laden was captured. There was a vaccinator that went to his home, a medical doctor, and even though from everything I've heard, there was no connection with polio, it got associated with polio. And as a result, there's been some resistance in some areas. In Afghanistan, we have the Taliban, and they aren't always permissive about letting people in. But the number one issue is getting those polio drops in the mouths. And to me, this is Rotary's program, WHO, UNICEF, CDC, the Gates Foundation, Gavi, but it's really the program of these parents. And we need to have them understand that in order to get this done, it's the parents that need to take ownership of it. They need to feel it's their program. That's why this community-based vaccinations is so important. We also have people like Carl Chinnery. I'm looking forward to hearing Carl of, people that, had some early struggles with polio. And, they're some of our best advocates, not only here in our country, but also in Pakistan and Afghanistan. So I'm confident, Governor, we're going to get this done. But we need everyone's support. We have the patience, but not too much. We certainly have the persistence. And from what I've seen around the world, everyone has the passion. And it's that passion that's going to accomplish this. So thank you very much, Governor, and great to be with the folks in Texas and tonight. And I see someone from India, and at least Joan Firkins is here from Vancouver Island. So good to see some folks.
Well, thank you so much, Mike. And we just appreciate your leadership because this is not a small endeavor. This is something that's been going on, like you said, for a long time. And we have resilience and persistence. And so without people with your type of vision and strategic guidance, I imagine that we will be floundering and really trying to pick up the pieces, especially during times like COVID-19. I have a quick question for you. So how do you combat at a RI position or level some of the untrue news that kind of spreads really fast in order to get down to those last 2 countries and still administer the vaccine, or try at least to convince those folks to do so?
Yeah, good question, Xavier. We work very closely with the governments in the area. We really depend on UNICEF to do what we call social mobilization. They also hire people in the community who spread the real truths, the real information. We also have offices, emergency operating centers in each of the states in Pakistan and Afghanistan, and they're monitoring social media. And if something gets out there, they're very quick to get on and to give accurate, correct information. But it's we all see things on social media that we are left scratching our heads. And it's it's another challenge we have, but we can also utilize it for the positive good of getting the positive message out.
Thank you. And just one more question for you. So with COVID-19, that's going on right now, and it did take us off our game just a little bit, but we didn't lose step. Like you said earlier, we're back on, and we are administering in areas that we deem safe. Do we expect that it will just be over the next year a tag team between using our labs and resources and COVID, or will we get solely focused back on polio eradication?
Yeah, I expect there'll be a little bit of an overlap into next year, but we've fully resumed the polio activities in most places. The other good news is we were a little bit worried of would there be more resistance to the vaccine, particularly with people coming to your house with masks and everything else, and our experience has been so far with the early data is that's not true. We haven't had resistance, which is very positive. In fact, I live in a place called Cape Elizabeth, Maine, which, the background, my picture here. And, the refusal rate is higher in Cape Elizabeth, Maine than it is in our toughest places in Pakistan. So it's just a matter, the problem is there's some neighborhoods we can't get into at all. And but once we go door to door, the refusals are pretty slim.
That is awesome. Someone just commented, Carrie Quinn, she said, my college roommate was from Cape Elizabeth, Maine. So
that's great, Carrie. Wonderful community.
Great.
I hope you visited sometime.
Great folks, great folks. Well, thank you again, Mike. And if you don't mind sticking around, and I'll tell you for the folks in the audience, if you would like to put any questions off to the right, we'll bring those back to Mike. But next up, we have Pastor Governor Carl Chinnery. He's on the line. He's a polio survivor. And not only was Carl a survivor, but also those folks in his immediate family. So Carl, without further ado, thank you so much for being here. And if you could just speak about your experience and where you see things going today, and how important the work that we're doing as Rotarians.
Thanks for inviting me, and I don't know how you were able to get the leader of our polio eradication like on the line, but you are very fortunate. I heard him last night as well as this morning, and his message is loud and clear and very, very concise. Thanks, Mike. Well, I guess my role is to share with you what might be appropriate to a personal recollection of what polio has meant in the lives of those experiencing it. Fortunately, we in the United States have been extremely lucky to have been on the forefront in developing the polio vaccines and administering them in the United States ever since the 1950s. Just real quickly, the Salk trials were 1952, the Salk vaccine was 1955, and the Sabine vaccine was 1960. So it has not been that long. But our memories fade over time, and we forget what a devastating effect a serious medical problem can have on our lives. Mike related about swimming pools being closed in the summer. I can remember driving down the street in Kansas City years ago, and a talk show host named Walt Bodine had a pediatrician who had just retired after 50 years of medical practice. And Walt asked the pediatrician, what in your years of medicine has changed the most? And without hesitation, the pediatrician says, we no longer have the long hospital wards of polio victims in the summer. Two things that might be different with COVID and polio. One is that every 200 infections of polio leads to irreversible paralysis. So it's a very visual kind of a reminder of what that disease can lead to. And secondly, until the 50s, we didn't know what the cause was for polio. And we do know what the cause is for COVID. So hopefully we can address that. But in terms of my message to you, Stories make events come alive, so let us mentally transport ourselves back to 1942 and enter the home and life of one family. The home belongs to George and artist Chinnery, my parents, and at that time, my four brothers and myself. The oldest brother, George, age 9, Bill, 7, Richard, 5, Larry, 4, and myself, age 1. To get right into the picture, I want to read a letter written by my mother when she was 89 years old, reflecting of what happened in those years in 1942. Dear Carl, this is very hard for me, but you asked me and maybe just it will help someone else. It must have been August 7th, 1942, when Bill came in and announced he had poliomyelitis. I didn't know where he had heard of such, but I said, if you have poliomyelitis, you go straight up to bed and stay there. And he did. We really did feel bad. We did the usual things to care of a sick person. He stayed in his bed at least a couple of days, and then George became ill. I called Dr. Eldridge, our pediatrician, and he came several times, but didn't give the illness a name until the night of August 11th. George couldn't swallow his medication and came back up through his nose. I called the doctor again and he came right over. Dad was on the road selling. I don't remember who stayed with the others, but Dr. Eldridge took George and me to Old General Hospital in Kansas City. They took George but wouldn't let me stay at all. No other hospital in Kansas City would accept us. I sputtered, but they wouldn't even let me go with George. I went home and called Dad. He started home immediately, drove all night, and went to the hospital about 4 a.m. But they wouldn't let him in either. He came home, and at about 7 a.m., the hospital called us and said George was dying, to come immediately, which we did. When we arrived, George was gone. He was tied to the bed, feet at each corner of the bed, hands over his head and fastened at each corner, stripped naked. We stayed in his room as long as they would let us, and of course, Dad had to make arrangements, which he did. I firmly believe George probably would have passed away anyway, as he had polio, the most virulent strain, and probably choked on his own juices. However, I will always believe the treatment he received at the hospital killed him just as much as the disease. I believe he was frightened to death and will always think so. By that time, Richard, Larry, and Carl had also become sick. And when I got home from the hospital, Richard was much worse, and we rushed him to the hospital. When we marched in, I informed them I was staying. I had lost one child, and I was staying no matter what. I don't remember how long, but Dad and I took turns, so Richard always had one of us there. One of Dad's aunts had come to help us and stayed with Bill, Larry, and Carl. Carl was an infant and stayed in his crib much of the time. An intern was watching Richard and doing a pretty good job. Dad sent someone to get me to go to the funeral home to see George, but I wasn't able to go to the funeral. When I got back to the hospital, Richard wasn't doing well. And in the night during the intern's coffee break, I saw Richard's skin sink into his chest. All I could see were bones covered with skin drawn tight. I ran as fast as I could down the hall, calling the intern. He joined me and we ran back to Richard and this man picked Richard up and plunked him into an iron lung. He didn't even get ready. However, he didn't fight it, but breathed along with it. His lungs had collapsed. The radio stations throughout Kansas City put out a call for anyone who had had polio to please go to the hospital and give blood to save this little boy's life. One young man or boy answered and gave his blood. We never did see the boy or have any idea who he was. He had walked miles to help someone he had never heard of before. I am most grateful to this unknown person. Richard was whiter than this paper and failing. The machine was breathing for him, but when they started giving him the boy's blood, it was like a perfect miracle. His skin gradually started turning the most beautiful pink anyone has ever seen, and he started coming back. I don't remember how long we were at the hospital, but they treated us much better. When we went home, we had to start the Kenny treatments. There was one nurse at Old Children's Mercy Hospital who would give us the treatments if Dad would go after her and take her back 3 times a week. Since it was wartime, gasoline was rationed and we didn't have enough gas stamps. But people we had never heard of, and some we knew quite well, gave us stamps so we could get this nurse. We had to have 100% wool blankets to tear into strips and put in boiling water, run through a tight wringer, and place on each child for so many minutes, then off for so many minutes, then on, etc. Dad put a hot plate in an upstairs bathroom to boil the water. He put an old wringer over the tub with stacks of 100% wool strips handy. Bill had done better and was on his way to recovery. But Richard, Larry, and Carl were the sick ones now. Dad hired nurses to help during the day, and my dear mother drove from Concord, California to help. Plus a very loyal girl had helped me for several years who had become a WAC in the Army. She told them her family needed her and they let her come home. We were one busy Army ourselves. When the boys were well enough, we had to start therapy, compliments of the March of Dimes. I took my children, another lady in leg braces, and her little boy 3 times a week. Richard has one leg a little shorter than the other. Crippled for a long time. Charles' chest never filled out. Bill had many problems. And of course, we have one little boy, Angel, in heaven. It took 60 years for my mother to write this letter and to talk about polio. My dad never did. That's the legacy of polio. We must not forget. Think about people helping people by peace through your service, by engaging Rotary and changing lives, both in the past and presently. Family doctors, caregivers, neighbors, gas stamps, sharing rides. I encourage all of you, find your tool to engage Rotary and change lives in whatever area of focus your passion may be. In Rotary, we don't divide our work by nation, culture, or language. It doesn't matter what is printed in your passport. What matters is that you believe in service above self. Your problems are my problems, and I care enough to help you. Thank you for being Rotarians and for listening.
Wow, Carl, that was a very amazing tearjerker for me, and I'm sure the rest of the folks here in the room. And just thank you so much for sharing your story and the letter that your mother wrote. Just a few questions, and feel free to ask your questions in the chat. But my first question for you is, knowing that we're this close to eradicating polio, and it being the second disease that will be eradicated from the face of this planet, and you yourself being a survivor How does that make you feel to live in this lifetime and to see the work that's being done and knowing that it will be eradicated soon?
I joined Rotary in 1977, and the first action that Rotary took in terms of polio work was 1979. I had no idea that the years would pass and that my life would change so radically, and so much time spent on a disease that I didn't even remember. I couldn't remember because I was too young. So it really has made a difference in my life, as well as it's a big thanks that I give to Rotary, having been a member.
Yeah, and thank you for your contributions over the years to not only being a survivor and your family also going through such a nasty disease. When COVID hit as well, did it, knowing your mother's story and her letter, how did you take on what was happening in our world today with the pandemic? And what's kind of your message to us in regards to COVID and how serious we should take it as we kind of navigate these troubling waters?
There are so many similarities that Mike had alluded to in terms of how the public reacted. There are illustrations of people who would, or whole towns that would be shut down. They would think that maybe newspapers transmitted polio. Obviously, the swimming pools were a likely suspect. Nobody knew. So really, surveys showed that aside from the atomic bomb, in the 30s, 40s, and 50s, polio was more feared than anything else in the United States.
Wow. Wow. One question from the room. Someone asks, Carl, have you seen or had any post-polio syndrome effects today? And I know you don't remember having it, but has anything come about from having polio?
Mostly just my brain.
Well, I'll tell you that you're super sharp, sir, and you being here today.
There's all kinds of ailments that you wonder whether they're a throwback to polio, but I can't say actually that I don't know. The answer is I don't know.
Great deal, great deal. Well, again, we'll appreciate you being here and sharing your family story with us on this very important town hall. And of course, we're going to celebrate the work that's been done over the years this Saturday. And I'll share with you anyone else that wants to ask a question here, just put it in the chat. And when we do a roundtable at the end, we'll come back to both Mike and Carl. Next up, we have Dr. Linda Ellsworth. She is our district medical director, and she's been definitely letting me know what's happening and how we should navigate COVID-19. In my lifetime, this is the first thing that I've never been through something like this myself. And so when July 1st kicked off, I said, I need someone in our district that can help us navigate this thing. Yeah, we're paying attention to the World Health Organization. We're paying attention to the local governments, et cetera. But I need someone on the team that is going to read this stuff, dissect it, and let me know. And Dr. Linda Ellsworth said, I'll do it. And she's been sending me updates. So thank you so much for being with us this evening. And from your perspective, Dr. Ellsworth, can you just discuss how COVID's been going and where you think it's headed, and just a little guidance for our clubs? I'm going to unmute you there, or probably have to hit, there you go.
Now, can you hear me okay?
Yes.
Can you hear?
We got
Hello?
it. Sounds good.
Okay. All right. Well, thank you, District Governor Xavier, for inviting me to speak today. I'm so glad that District 5840 is highlighting Rotary's worldwide efforts against both polio and coronavirus. I just want to look briefly at coronavirus, where we are now and what lies ahead. and also highlight Rotary's international infrastructure that is useful for handling both polio and coronavirus. As far as COVID itself goes, well, it's getting well known now that this is called a novel virus. It didn't exist before. This is new. And first and foremost, we know it's a respiratory virus. It's related to our breathing. And in fact, we now know, it sounds gruesome, the lung fills in severe cases with this jello-like substance, which explains why we can't do very well with ventilators. But it also affects other organs, we're finding out. The heart, very seriously, kidneys, and now brain. And there are even so-called long haulers that may have symptoms for weeks or months. We don't know what's happening with children or what will happen to them the rest of their lives. The other concerning thing is that this is a deadly virus. It's the most deadly thing we've dealt with in over 100 years. And also concerning, we're finding out more now, asymptomatic transmission is so important. 40% of people that have this are asymptomatic and don't even know they have it till they get tested for some reason. So we'd have to say that more is still unknown about this than is known. Now, where things stand now, in the near future, we're facing this winter, it looks like, a so-called twin-demic. Now, that's where we might have flu and coronavirus superimposed so that our healthcare systems may be overwhelmed. And heaven forbid if someone themselves has both flu and coronavirus at the same time. So that could get very serious. What we're faced with right now in terms of control is mitigation. We've all heard about that, but we just need to be consistent and not have pandemic fatigue. That's the masking, physical distancing, hand washing, and we have to keep that up for a good while yet. We eagerly await a vaccine, but only a few people will receive this at first. We'll have to prioritize, and then like flu virus, this won't be 100% effective, unfortunately. So we hope it's 60% effective. So this is not going to be a panacea by any means. We'll have to be very careful for a good while now. We're also looking at Rotary's activities internationally in terms of the infrastructure, which now enables us to manage both polio and coronavirus. This would have been much more difficult in many parts of the world if the structure for polio management and teamwork had not already been available. In fact, it's estimated that nearly half of our polio assets around the world had to move into coronavirus response and management. But the Rotary system, which has frontline workers in communities, things already set up like contact tracing, have developed a lot of capability there. These grassroots organizations have helped build community confidence compared to if we just had so-called external experts going in and telling people what to do. So this has really been remarkable, and Rotary's done this for a number of diseases and population needs. Now, there are still barriers that we faced with polio and coronavirus. Problems with illiteracy, poverty, disadvantaged populations that aren't in the mainstream, and other problems that are arising, migration because of these severe diseases, the resulting homelessness, but also mixed in is problems with climate change, drought, shortages of all kinds of water, but especially drinking water. So it's a very complicated situation right now. And Rotary's infrastructure and teamwork with other organizations has been invaluable. So I'd just like to say, what can we do? And one thing we can do is celebrate World Polio Day on the 24th and do our part for polio eradication, whether it's donations or whatever we might be able to help out with. But we're all very committed to this. And in closing, I just want to remind people there will be more pandemics, and they're only a plane flight away. Thank you.
Thank you so much, Dr. Ellsworth. And I'll share, when you talk about where we are right now, most of us on this call, we know someone who's been affected by COVID, but a lot of folks don't really have anyone right next to them that has experienced COVID firsthand. And so we're kind of watching from afar, just a little bit. And I want to ask you, we talk about fatigue, because I'm feeling it, I want to take a trip to Tulum right now, somewhere
Yeah.
to get away. I think we're going to be here for another year. What are some things that we can do to ease that fatigue a little bit? Or is it just, you got to survive and you have to do whatever it takes? How do we navigate that?
Well, I've been pretty sequestered myself because of some of the people I know and relatives. And I think we all have to find some ways for mental health breaks, physical breaks. Number one on the list is probably exercise. That helps both our physical condition and our mental condition and our tolerance for this. Another thing is getting outside. Now, this is probably the best time of year in San Antonio, I believe. And if we can get outside every day, I think that helps. And also have spare masks everywhere. You don't want to be caught without a mask, because it's that one time that someone slips, and this is what I hear reading about cases, is that one brief moment of forgetfulness, or when somebody, decides, oh, we can go to this family gathering, they're all healthy. Well, I just recently read about a college student who went with his family on a family journey and infected, I think, 11 relatives. Wow. So, nobody is really safe. And I think if you have your little so-called pod or bubble, there are some people that you're almost sequestered with, then they may be safe. But I look suspiciously at anybody, frankly, that I'm physically around that doesn't have a mask on, that I don't know their antecedents. And it's just like all contact tracing, which we learned about in medical school, that, you have to know who's been around what person, and then all the people that they were around, and so on. It's a very strict process, contact tracing. Well, anybody you see without a mask that's just in your presence for 15 minutes, never mind whether they're coughing on you, just the breathing, especially in an enclosed space, that's what you really have to watch out for. So yes, outdoor small gatherings, outdoor restaurants, things like that are other things to be sought out. But that one mistake could literally be fatal, if not to you, then somebody that you care about.
Very, very true words. And thank you so much for your guidance. Carrie Quinn and Chris Quinn, they say, thank you for your time tonight. They're from your home club of San Antonio today.
Right. Hi, Carrie. Hi, Chris.
And just thank you so much for, it's not always easy to give bad news. It's not easy to say, hey, I don't think clubs should be meeting in person right now. It's not easy, right? But it's a necessity that we all stay together in this time. And not only ourselves, but keep up.
Yes, if I may say so, our president of our local club, San Antonio downtown, Steve Darling, is being very cautious, convening a committee to discuss about the club's future meetings, and is being very cautious. And our reopening has been postponed, indefinitely till something is better.
Absolutely. And I'll share, I speak to Steve, and I'll tell you, it's not about being popular this year. It's about making sure that folks are safe, and we're doing what we think is best to navigate these troubled waters until we're out the clear. So thank you again, Dr. Ellsworth.
Certainly.
And being on.
Thank you for having me.
Thank you so much. Next up, we have Charlie Wasser. Charlie is our Polio Plus chair. He's going to talk about what we have going on in the district by way of fundraising and some other initiatives. So Charlie, without further ado, the floor is yours.
Now, can you hear me right now?
We hear you. You're very low.
Very low. All right.
Where are you?
On somebody else's computer. See, I'm even using one of these.
So let me help you out, Charlie. Right there next to the mic on the computer,
Right.
there's a button there's an arrow that points up.
Okay.
Hit that arrow and click audio settings.
Where do I click audio?
So on that, next to that microphone right there in the lower left-hand corner on your computer,
Right.
computer screen, you see it?
I see the arrow. I push the arrow.
Okay, now hit audio settings if you see it. Do you see that?
No.
Nope.
Nope.
Well, let's see here. What else can I do to support you?
It's still quiet. Am I still quiet?
You're very low, so maybe getting up very close to the mic. Let's just do a couple tests.
How's that?
That's a lot better.
All right. I will promise not to eat the mic. I always
Okay.
do that with mics. I hate it like this. But nonetheless, good evening, everybody. And I definitely have to start with a thank you for, past District Governor Mike and Carl and Dr. Linda. Over the years, I've developed a passion for polio, and I knew that the three of you would bring that passion to the district and remind me of what it's like and why it's important. Over the years, I have traveled around to different districts nationwide for pets and district conferences and things like that. And that was where I first ran into past District Governor Carl. It was in South Lake Tahoe, and just to add some ideas, it was a 3-day district conference and the theme was Polio Plus. The governor and I are friends, and he told me about Carl, and I went away from what I was doing and went to listen to Carl talk. And like most people in the audience and most people here, I was wiping away the tears. It shows us the depth of the problem and how bad it was and where we could go back to if we're not careful. Because over the years, people have said, well, we can't get past 500 cases a year. We're never going to eradicate it. And that number ends up turning into 200,000 new cases a year because it just goes nuts again. So basically, the job is to eradicate it. The other part of the job is to build a legacy for other diseases that come along. Just by coincidence, a little tongue-in-cheek is probably inappropriate, coronavirus shows up just as we're trying to prove and have an end game with polio. We're finding that the legacy that we're going to be leaving with Polio Plus will help with COVID. And as Dr. Linda was saying, there will be more of these viruses, unfortunately. It's just something that happens in the world. We're all basically biologic units. These are other biologic units that will attack us. So we have to be ready with the process. That said, the important thing that I'm going to talk about tonight is fundraising. And I'm from TRF. So foundation people always raise money. And just to warn you, if I ever ask to be invited to your club, district governor of my other districts told me once when I was walking into a meeting looking for money, he goes, oh my God, here comes Wasser. He's always asking for money. So at least you know who I am and what I'm doing and why. Anyway, what we're going to be doing with in 5840, the first one coming up as a district initiative is a Christmas card. And if I could have screen share.
Charlie, try to share now.
No. Go ahead, say that again, Xavier.
If you want, I can share it for you.
Okay, if you can see the screen, and oh, you have the card too, right? Or do you want my card?
I can share it. Here we go. Let me share it real quick.
Ah, there you go. And I had my favorite artist, District Governor Xavier, do this for us. Basically, we're going to be selling these cards for $10. Should cost the district around 25 cents to 50 cents. And they will, bring in quite a bit of money. One of the clubs has already sold 40 cards sight unseen. Years ago, when I was still living in California, a friend of mine was a pastor in an Assembly of God church. And I got him into Rotary, and he got really excited about polio. And he offered me the opportunity to speak from his pulpit on a Sunday morning. And not to make it sound negative, but the congregation was blue collar, so these people really did not have any money. Within an hour, I raised over $500 selling cards. In some cases, people came up and bought the cards. In other cases, they just gave me money, said, I don't need the card. But what was common was there were a lot of people that said, thank you for giving me an opportunity to participate. I can't afford Rotary, but the idea of doing this for $10 I can afford. And some had little kids come up with the $10. They were teaching them about giving and serving others. And I get choked up when I think about this story. I do go around to clubs making presentations. I'm more than happy to go to your church group or whatever group you have to make these same presentations. The Christmas card, the inside of the Christmas card, I won't bother trying to share that screen. The inside of the Christmas card will have a message to whoever the recipient is saying that the money has been donated in that person's name. And because of the $10, 16 children will have a lifelong, they'll be vaccinated against polio for their life, just for that $10. So 16 kids are being helped. And since we're down to 2 countries, that money is going to go a long way, even though we still have to keep vaccinating children in other countries. You know, again, the cards, we're ready to go. The cards will be in physically over the next couple of weeks. I will be sending out an email to my leadership mailing list, which includes club presidents, past district governors, and if anybody else wants to get on it, let me know, explaining the program and how it works. There will be a way that people that donate will be able to get credit, their TRF Paul Harris points, if that's an issue. You know, and the last time I tried doing this, I brought in over $20,000. You know, so it's an easy way to make money. If you look at members of your club that don't donate, they don't donate because they don't have the money. It may be easier without embarrassing them to give them a chance to donate the $10. And that, of course, will finish a little before Christmas. The next thing that we're looking at doing in November, there's a bike ride called El Tour de Tucson. And that brings in around 9,000 people, and any nonprofits that want to can sign up to be part of that and raise money for their cause. Over the last few years, past District Governor John Hutcherson and Bill Philpott have participated in it. I am putting together a committee which includes those 2 gentlemen to try to come up with a plan of how we're going to get the entire district involved. It may be something like, you know, each just divide the district into quarters or something, and each quarter of the district raises a certain amount of money as part of a contest, you know, and if there's a prize, it may come down to bragging rights. We're Rotary. We don't expect to get paid back, but we'll come up with something. But nonetheless, we're going to need 4 riders. One of the people that has already volunteered is my favorite club president, Richard Diaz. And that was, I told him about it on a text or something. He said, I'm in, I want to do it. And the second person, unless I get talked out of it, is me. I figured I'd wait until I was 70 before I decided to take a 100-mile bike ride. And anybody that wants to talk me out of it, I'm easy. Now, the other 2 guys that are on my committee, John and Bill, they don't know this yet, but I am good with Jewish mother guilt. I'm going to try to get them to ride, so we'll have our 4 riders. However, if anybody else in the district wants to come with us, it would be a lot of fun and be great PR for the district to get involved. And as a last thing, like I said, I do make talks around the district. I've done about 10 clubs already, talking about the history of polio and how it equates to COVID-19 and the effort. And quite frankly, I was buddies with a past RI director. Some of you may know him, fellow by the name of Brad Howard, who we were talking on the phone once when I was taking over, and I said I was really psyched. He said that he felt sorry for you know, people that were taking over the role of Polio Plus chair because we were reaching donor fatigue. There's that magic word again. You know, it's like every year we say, hey, we're this close. And it's like, well, when are we going to be done? Just my favorite past district governor, John, just said he would do the 50-mile ride. So we have 3 riders. You know, Governor Xavier, you're young enough. But anyway, I am done.
Thank you so much, Charlie. We really do appreciate the effort and work that you're putting in to make sure that, you know, we are definitely covering ground in regards to our Polio Plus contributions and support. And thank you so much for sharing. I think the Christmas card is going to be a winner. And if you guys noticed in the Christmas card, there's a small little End Polio Now emblem that matches this tight shirt that I'm wearing. But it's a friendly card that says, hey, End Polio Now, has a nice little message to Charlie's point, but it also is Christmassy enough to sell. So I hope you all get involved and buy quite a few of those so we can raise money and contribute to a great cause. To John, Bill, and Charlie and all those guys getting on bikes, bravo. I will be on my stationary and right here in the house, and I'll cheer you guys on as I eat ice cream and donate some money. But thank you all for everything that you're doing along the way in this particular endeavor. I did have a few questions. I know we're about 6 minutes over time, but just a few questions from a few folks in the room sent me for Mike McGovern. And again, thank you again, Mike, for being here. Question for Mike said, and this is from Pastors to Governor John Hutchison. Are volunteers needed in Pakistan to participate like they did in India? His wife Judy, Pastors to Governor, and Hutch have been to Pakistan twice, and will look forward to going back. So, are there any volunteers needed?
You know, still we encourage people to go to India. They're still doing national immunization days there. There's a few people that go to Pakistan, but we don't strongly encourage it, because one of the things we're trying to do is make them feel that it's their program. But, you know, certainly in the cities, you know, the Aziz Mehman is quite supportive of assisting people who do want to make visits, as of the Rotarians there. But, you know, it was just hearing, you know, up in the Khyber Pakhtunkhwa, right up near the Afghani border, and not a place to go. I get nervous. They had a polio activity there today, right on the border, and all seemed to have gone well. But yeah, there's security issues, and plus there's also the wanting the program for them to feel that it's their program and not someone else imposing it on them.
Thank you so much. So there's your answer, Hutch and Judy. And for Dr. Ellsworth, again, thank you so much for being on the panel this evening.
Thank you.
I had a question for you. So it says, this is from Joe in Fredericksburg. He said he's one of those likely to be first in line for the vaccine due to his age and his health issues. He said he's heard that they will have 50 million doses early, but he also heard that it will take probably 2 doses. Does that mean that only 25 million will be treated? Also, how long after the vaccine will it be fully effective? And will 60% effective rate be doubled to 100 with 2 doses? So a loaded question, but
Yeah.
Okay,
yeah, let me try and unpack that. The hoped for 60% would be after 2 vaccinations. I don't know how far apart those will be given. Oftentimes, like the shingles vaccine, that's 2 months apart. So then looking at the triage for who will get these, well, everyone pretty well agrees that frontline workers, the healthcare providers, will be first in line, and depending on availability, simultaneously, or the second tier will be those because of age or pre-existing conditions will be given the very next round, and so on down the line. And I think probably third line would be probably everybody else. So of course we do have a great many Rotarians who are in that high risk group. And I think that we will see them getting some of the first available doses. And it's not just they'll have one batch. These are going to be coming online all the time. So there will be more, probably in rapid succession, once we get the safe and effective vaccine. And I would encourage everyone that gets a chance to take the vaccine. I'm not terribly worried about the side effect aspect. I think because of our national security and testing, and elsewhere too, there are a lot of reputable research and lab institutions that are developing these, and I think they'll be perfectly reasonable to take. There have probably been some other vaccines that might be more risky, but not so much these. So I think they'll be just fine. The flu vaccine, I hope everyone's had their flu vaccine, is very safe, effective, and mine this year was painless. And I just want to say you need to be sure and get that. So, you know, you can certainly check with your doctor to see as these become available, but I'd certainly recommend going out and getting them. The flu vaccine takes 2 to 3 weeks to become effective. I don't think it's known how fast this will set up your immune response, but an immune response can be triggered that fast, so might be fairly quickly. You know, within a month or two, I'm just going to estimate.
Great deal, and thank you so much. I think
Sure.
you did very well. Well, again, I want to thank everybody. I don't see any other questions from the room, but I want to thank you all for definitely chiming in this evening, and definitely to our RI representative, Mike McGovern, past District Governor Carl Chinnery, Dr. Ellsworth, and Charlie. Of course, thank you all for being a great panel this evening for such an amazing and important occasion, which is polio eradication, and also staying abreast of other infectious diseases and other pandemics to come. I think we learned a few things this evening. We're resilient. As long as we stay on the path that we've been going, our contributions, our awareness of such programs such as our polio campaigns, Paints for Polio, etc. Let's keep doing those. Let's keep spreading awareness and getting folks on board. I think if we stay resilient and we stay disciplined and stay in our homes as much as we can and wash our hands and bubble up as you see fit, just do everything you can to keep not only yourself safe, but also others. And to past District Governor Carl, thank you so much again for sharing your family's story. Thank you for staying in the fight and being an outstanding Rotarian that continues to share this message so that we understand how important the work that we do is. Again, November 5th, we will have our next district town hall. That will be with our foundation team. That's past District Governor Jerry Hardy. And I see Amy Balkan, she was on. Thank you so much. And we'll see you District 5840 Town Hall, November 5th. Thank you all for being here and have a great evening.